relevant research. Parkinson's has a lot of literature that's out there on treatment. But even with some of the good research and literature out there, I see therapists, and I am guilty. I used to do this exercise, doing exercises that really aren't very evidence-based. One of them is reciprocal canes. And in case you don't know what it is, I'm going to show you it once I go over the research and give you an alternative. The alternative was published in Rehabilitation Research in September 2000. The article is by Battelle. The title of the article is "The Effect of Exercise on Perceived Quality of Life of Individuals with Parkinson's Disease." It was an 8-week pole striding exercise program, and it showed an increase in function and gait and quality of life. These people worked for three times a week for 27 minutes with Exerstriders. Now, the difference between an Exerstrider and reciprocal canes is with the Exerstrider, you're using something, in the study they actually developed Exerstriders, but you can make them, very similar to Nordic track ski poles or Nordic ski poles. And you put them in the ground and you walk reciprocally one arm to the other. And I'm going to show you at the very end of this. With reciprocal canes, and I'll show you that first, we hold the canes, our patient with Parkinson's holds the canes, and we just push their arms back and forth. Well, why aren't there studies showing that reciprocal canes work? Why? Because we passively move our patient's arms, and when we stop using the canes, they passively just let their arms fall. With the Exerstrider, they're actively moving their arms back and forth. So let me show you. So this is reciprocal canes. You passively move their arms back and forth like this. Now, let's look at Exerstrider. And basically what you do is the person just actively moves their arms versus the passive. And they take steps right, then left. And what that'll do is really work on the reciprocal movement because they're actively doing it. All right, and again, you don't have to have ski poles. You can use broom handles with crutch tips, anything that you can get your hands on that they can literally do some good reciprocal movements. So there's the research. Use it.